in-person panel.
Good morning again. Amy Barden, Seattle Care Department. So Seattle established this third public safety department because by the data, half the calls do not require fire or police. They just don't. And that is consistent across the country. I'm part of a national Transform 911 movement. We need co-response everywhere. And in big jurisdictions, you need alternative response options. There is a difference between first response and secondary response. First responders all need to be availed of the same trainings, the same liability provisions, the same protections, and the same peer support. So I encourage you to think about it that way. These are first responders. And so whatever you would provide fire or you would provide police, you should provide community responders or co-responders. In Seattle, we're all on the same channels. That's really important. We can see the same data. I can see uniquely if somebody pops up in the CAD who just overdosed yesterday. I know that. And I know if somebody is already justice impacted, I can see that. It's a coordinated, consolidated approach. I'll share with you that I'm on a CSG Expanding First Response Commission. And I was so proud yesterday in our meeting. These are about 30 folks around the country, all very expert in this space. And we were talking about professionalizing the first responder workforce, the community responders. And I was so proud to share what Washington has done since 2023. I described CROA. I described BH Corps at UW. And it is becoming a national model. We are investing appropriately in the right first response to a 911 call. So I urge you to continue to support these bills, 1809, 1811, 1816. These are all significant steps forward. Happy to answer any questions.
Any questions? Okay, seeing none, whoever wants to go next, please proceed.
Thank you again. Kim Hendrickson here representing BH Corps at the University of Washington. It's always such a pleasure to follow Chief Barden. This is a historic moment for me. I have been an advocate for co-response for the last decade in Washington State, and the fact that the state legislature is considering 3 bills this session, 1811, 1809, 1816, that will strengthen co-response around the state seems to me like a real celebration of what this movement is doing in Washington. And indeed, the bill itself and the definition of co-response recognizes the fact that in Washington State, we have gone further and farther than most other states in understanding the potential of co-response. Co-response is certainly crisis response, but it's also follow-up response. It's police response, but it's also fire EMS response. In Washington State, we have built out a system of over 50 co-response programs that are so varied and diverse depending on the needs of the community, where it's located, the staff that are involved. And this bill does a wonderful job at defining co-response in that broad and inclusive way that I think really is a model for the rest of the country. I know I don't have a lot of time, but I'd like to speak briefly to a comment that was made during the last testimony session about the potential risks that co-response have, about operating in contradiction to mobile crisis teams and community behavioral health care. I strongly reject that suggestion. Co-response has grown in the way that it has in Washington State because it's filled critical gaps. We really respect and appreciate our partners in community health. We respect and appreciate mobile crisis teams across the state, but it's simply not enough. Co-response has grown bottom up in Washington to fill gaps in communities to make sure when somebody does call in the middle of the night that there is a response that's trained and adequate. I'm so grateful to the co-responders and first responders that have filled gaps, and I think and hope that we will and continue to work together with our partners on the mental health side of the house to make sure the right response exists for everybody. Thank you.